Good afternoon, everyone. Thank you for joining us for today's webinar. My name is Ellie Amador, and I'll be your host. I work for the University of Tennessee system, and I'm one of the organizers of the Pandemic to Possibility webinar series. While the pandemic has caused great adversity, it's also led to great innovation. And sharing these success stories in hopes of inspiring more collaboration and momentum is why we created the series. We're grateful to our partners at the Tennessee Chamber and the Alliance for Better Nonprofits for making today possible. We're also grateful to our speakers for dedicating their time and sharing their expertise. Before I introduce them, let me spotlight you for a minute. You represent a wide range of industries and organizations. For example, FedEx, Knoxville TVA Employees Credit Union, the Williamson County Mayor's Office, and Goodwill. On behalf of everyone involved, welcome. And if I didn't mention your organization, feel free to give it a shout out in the chat. This afternoon, we are presenting Back to Business, which is a session dedicated to the lessons learned from phased reopenings, COVID protocols, and we're going to talk about legal protections available to all businesses in Tennessee and available to you as decision makers. So today you'll hear an overview of the business climate in Tennessee. You'll hear about Zoo Knoxville's experience navigating a closure, reopening, and navigating a constantly evolving situation. You'll also hear about resources available to help you in your own decision making and about relevant legislation and legal protections. Two housekeeping points before I introduce our speakers. If you have any questions during the presentation, please feel free to type them into the chat box in your Zoom toolbar there. I'll bring them up during the Q&A following the presentation. And of course, at the end, if someone wants to jump in and just ask your question live and directly, we would love to hear from you and see your face. Of course, we expect everyone to follow a code of conduct that is outlined on our webinar website, which is webinars.tennessee.edu if you need a refresher for what we expect from you in terms of respect and civility toward everyone involved. We are also recording the session, so we have about 55 participants registered to join us live, but we also will make the recording available to you if you'd like to share it with colleagues or others in your network. And we will be pushing it out from our website, the address I just mentioned, and from our social channels, which you are welcome to do that as well. Let's see, with that, let me introduce our presenters. We have with us today Bradley Jackson, and in his role as president and CEO, Bradley is responsible for the overall operations of the Tennessee Chamber of Commerce and Industry and the Tennessee Manufacturers Association. If you're wondering about that organization, maybe you're new to hearing about it, its primary focus is the development and legislative approval of business issues to ensure Tennessee is a top state for business growth and development. He's originally from Lawrenceburg, and he is a graduate of the University of Tennessee, Knoxville. So we're proud to introduce him today as a member of our alumni family. We also have Lisa New with us. Lisa serves as president and CEO of Zoo Knoxville. She's the fifth individual and first female to serve in this capacity in the zoo's 72-year history. She's contributed to the organization's growth and development in numerous ways during her 30-year career. Lisa is also a member of the UT alumni family, having earned both her bachelor's and master's degrees from UT Knoxville. Welcome, Lisa, and we thank you. And finally, here on my right at least, we have Nicole Watson. Nicole is an attorney at Waller Law Firm in Nashville, and she works out of their Chattanooga office. She represents the interests of corporate clients, industry groups, professional associations, and not-for-profit organizations before elected officials in the Tennessee General Assembly, as well as the U.S. Congress. And for her firm, she is appointed to represent the Tennessee Chamber. So that's the relationship between the two of them who are joining us today. And additionally, Nicole monitors legislative developments and educates clients on legislative processes, procedures, and progress. And she also manages a political action committee, or a PAC, perhaps, if you're familiar with that term, and fundraising programs for clients, providing guidance on grassroots advocacy efforts and development of coalitions. So thank you to Bradley, Lisa, and Nicole for joining us. And without further ado, I'm going to turn it over to Bradley to get us started.
Right. Well, thank you, Ellie. And I want to thank the University of Tennessee for offering, a number of topics that are relevant to business and nonprofits, things that are very important to us. So thank you all for doing this. It's greatly appreciated. I am Bradley Jackson with the Tennessee Chamber of Commerce and Industry. Just a little bit about the chamber before I dive in, really to set the stage for the discussion that we're going to have today about the pandemic and liabilities that businesses and nonprofits have. So the Chamber, we were founded in 1912. We have a number of partnerships. We partner at the national level with the U.S. Chamber, with the National Association of Manufacturers, and also the American Chemistry Council. Most importantly, perhaps, we partner with local chambers of commerce all across our great state in rural and urban areas. So it helps to give us a very strong grassroots presence. And in addition, we work with economic development agencies as well. So oftentimes when you hear about the business lobby kind of in the Tennessee General Assembly, or businesses are opposing something or supporting it, that's typically the Tennessee Chamber and a number of our member companies. We are a private non-for-profit. We do not utilize government funds. We are funded solely by membership dues from private companies all across the state. So more than likely, if it's a larger company in Tennessee, you all are very likely a member of the Tennessee Chamber, and we work with your leadership on any sort of government policy or initiative that you all may have, or things overall to support Tennessee's business community, workforce development, taxation, any issue that kind of comes up. So obviously the pandemic came up very important for Tennessee's business and nonprofit community. So 2020 being the year of the pandemic, I don't know if you all saw, my staff showed me an article where there is an asteroid in 2020 that's supposed to come close. So it doesn't surprise me, on March the 3rd, we had tornadoes and everything else. So all this really started around March the 5th, when Tennessee was actually the third state, I think, in the United States to have a confirmed case of COVID. So, California was first. So Tennessee was kind of very early in the entire process. So immediately a number of things started happening in the state. A number of businesses, you all, especially if you're in healthcare, you started seeing that there is a infectious disease around, and you started taking steps to kind of mitigate your exposure or to protect your employees or maybe customers. Then on March the 12th, things got a lot more serious. Governor Lee issued his first of many emergency order, which was basically it drastically changed what group gatherings, what businesses could do. So all of us at that point really started taking attention. Overall, the state closed. And keep in mind, this is something that had never happened before. There's really never been a major shutdown over an infectious disease. We've dealt with cold season and flu seasons and things like that. So there was a tremendous amount of uncertainty that was out there. If I'm a business or a nonprofit, can I remain open? If I do remain open, or I need to remain open, I have to remain open. Then what sort of things do I follow? Who is the authority? Is it the federal government, the state government, or is it my local government? Because there's a lot of conflicting information that I see out there. Another part of the confusion out there for so many is, what if there is a complaint? What happens is if there's an investigation, what do I have to show? Who is in charge of that investigation? And ultimately, what could happen to my business or nonprofit? Could I be sued? If there is some sort of allegation, and how would I be liable for that? So immediately we started hearing from businesses and nonprofits about what could happen, because if you're in the non-for-profit world, I know we were getting a number of questions from businesses like, what guidance do I need to follow? What should I do? What is the government telling me that I have to do to remain open? And there was a lot of uncertainty in that area. There were a lot of vagueness, and there was a lot of conflicting information that was going out there. So today I think we really want to go through a number of those things and give you all some guidance and background on what all happened in Tennessee, how it unfolded, and where we currently stand. So currently for businesses, if there is a negligence claim, prior to the pandemic, and Nicole will touch on this, but there's somewhat of certainty, like the rules of what can happen, how you can be sued. There's a lot of case law. What happens if there's an allegation. There's well-established standards in Tennessee. But when you deal with something like an infectious disease during this pandemic, there's no rules, there's no history, there's no guidance on how these things will be interpreted if there are questions that come up. There's no case law. So one of the things that we approached the legislature about is we believe strongly that the legislative branch, should take considerations when there's a pandemic. They have the right and certainly the authority to act to provide some certainty, to give courts guidance on how you want these cases to be interpreted. Because after all, this an infectious disease, this was not the business community's fault. It was not a nonprofit's fault that it happened. We are dealing with it because of actions that happen, from wherever and however. So when we ask about the things that we're talking about, a lot of legislators ask, well, what exactly are you all talking about? So there's a lot of realms of that. One is maybe customer complaints. I came into your facility or came into your nonprofit, and I think that I got COVID there because, a few days after that, maybe in 12 days or something, I got sick, and then, somebody at risk, I'm afraid I gave it to them, and then they may have been harmed. So, they could easily come back on you and make an allegation. Certainly at a restaurant or hospitality, we've heard consumer complaints that they come in and, everybody was wearing a mask. However, I noticed Bradley in the back took his mask down to take a drink of something. So therefore he wasn't wearing his mask the entire time. And therefore that exposed me to risk, or I may have gotten COVID there. Another thing is that, when you provide people PPE, whether they're an employee or a customer, they could allege easily that the PPE, I wasn't adequately shown how to put it on, or I don't think the PPE was the grade that it should have been. Studies show that the virus can pass through certain PPE. So the PPE that you gave me was not good enough. That could be an allegation as well. One example we hear from the healthcare community are nurses. Whenever there is an emergency because of COVID, it takes them a lot more time to be able to, apply their mask, their PPE appropriately to get to a patient, and they have to do that every time there is a patient that needs them to come in or has something, and that ultimately does cause some delay. So what if that caused a delay that caused a patient harm? So there's so many different things that can come up. But businesses, whenever we ask about this issue, the surveys that we saw were about 70% of businesses, whether they were essential or not, or not deemed essential, thought that this was a major concern from them moving forward. They want to be able to run. They have to be able to open. A lot of times they were asked by government officials to, if you're in a nonprofit, to help your respective communities. You may need to help with food, with daycare, aftercare, certain things. So when these elected officials ask you to stay open, the only thing that we felt like was fair to ask for, that we have some sort of protections really and predictability. Cases are starting to, obviously COVID cases are starting to, increase in Tennessee, but in addition, lawsuits are as well. I think, Nicole's given me information that already in Tennessee, there's about 55 to 60 cases that have really already been filed here. So for businesses and nonprofits, we really need predictability. When you don't have that, it causes concerns, and we want and have to be open during this pandemic. We just need to know kind of really what the ground rules are. One lawsuit should never open you up to run you out of business or harm your nonprofit when you're trying to do the right thing and you're trying really the best that you can with the information that you have. We have no control over an infectious disease. Any type of litigation can be very expensive. The data that we see, as high as, CDC estimates 10% of our total population to 6% could have very serious consequences from contracting the virus. So it's a very serious virus. And we want to be able to operate. And I know Lisa will provide a number of really good examples on behalf of the Knoxville Zoo. So with that in mind, Governor Lee did issue guidance for that. You can remain open if you are an essential business. An essential business, they took guidance from the Cyber Infrastructure Security Administration, which is under the Tennessee Department of Homeland Security. And those, you all know, that's a very broad definition, which we were satisfied with that. Even as a not-for-profit, we were able to remain open as we could. But we got a lot of questions. Businesses were asking us, well, if we are allowed to stay open, then what sort of guidance do I need to follow? Because the guidance, it frequently changed. It changed from, March the 30th, and it just recently changed. I saw the other day. So if you've been a business and you've been trying to operate in good faith and doing the best you can, even though those have changed, don't we deserve really some type of protection? So that's a lot of what we're gonna talk about today. We'll also dive into, the Tennessee General Assembly considered this legislation in a June legislative session. So that I know Nicole will talk about that. There was a first try that didn't get through, and then there was a second try, and we resulted in what we believe is a good, strong piece of legislation for business and nonprofits to have here. And we'll talk a little bit about how crazy it was getting that bill through. But with that said, I'm going to transition and turn over to Lisa New, who is president and CEO of the Knoxville Zoo. Lisa.
All right. Well, thank you, Bradley. Hi, everyone. It's good to see such a big group and a diverse group of people. We're going to talk a little bit about Zoo Knoxville's story, and hopefully there are some tips in there and some things that that you can glean from it. And if not, I hope that you'll please ask. We are a zoo, of course, with lots of beautiful wild animals, but we are a business first. So hopefully there's things we've had experienced that everyone would experience. Can you all see my screen? Sharing the screen, good. So, just to get started, as I was listening to Bradley talk, everything that he mentioned, I feel like, or most everything he mentioned was relevant to us here at the zoo. We experienced a lot of those same questions. When should we close? Are we an essential business? How do we do it safely? And I remember at the time, a board member said to me that I was, he's like, well, how'd you handle this in your last pandemic, Lisa? And, I was a little taken aback, and he said, you're guiding a ship in a tsunami right now. And you are getting tossed around everywhere, and you need to keep your eye focused on the shore. And the Tennessee Pledge that Bradley referenced, and that I think he'll talk a bit more later, was really that shore focal point for us. It allowed us to set up our business and to use it as a best practice, and to do it in a way that we felt was safe. And so I want to thank Ellie and University of Tennessee for this great series. There's so many great topics to explore. And of course, Nicole and Bradley for all the work that they did for the businesses of Tennessee. So my slides take just a second to advance. Let me get it to catch up. Of course, it's not wanting to advance. It's frozen, Ellie. I might need you to try it from your side.
Okay. It looks like.
I got it now. Let's see. All right, there we go. It's just a little delay because I have some videos embedded in there. The zoo closed on March 16th, and Bradley talked a little bit about the timeline of the executive orders that came out on the first announcement that came out on the 12th, when Governor Lee, I think, changed gathering sizes at 100, and to 100 or less. And I'll never forget that the Sunday on March 15th, I was walking through the zoo. I was thinking about the CDC guidelines. The pandemic was just ramping up. And I was really overcome as a business, not owner, but as the head of a business, with what am I supposed to do? And I tell you, when you walk through the zoo at the outbreak of a pandemic or any business, and you suddenly see all your potential liabilities and things staring you in the face, it's terrifying. You know, what before was heartwarming to me to see, you know, parents with their arms wrapped around their children, the children's faces plastered to the glass, looking at the animals, to me was like all these high touch points where a pandemic could be spread. So we were really in high anxiety, like many were at the time. And so we closed the next day. On March 16th, when guidelines went to gatherings of no more than 50 or more. And March 16th was right at the beginning of Knox County spring break. It really couldn't have happened at a worse time of the year for us. That's a key time of the year for the zoo, where we're emerging from a cash lean winter, and when cash begins to influx for us with warm weather and bigger crowds. Our cash reserves are so lean in February and March, and so closing really created an immediate and very dire financial crisis. And, you know, it was so dire, in fact, that to stay solvent beyond a few weeks, we had to take really drastic and immediate expense cutting measures. So closing at that time was a difficult choice, and it was prior to any mandate of closure, but we were an institution of public trust, and acting as a leader in our community and taking that initiative was very important to us. As a community-focused institution, we have responsibility to keep everybody safe. Here at the zoo, that includes our staff, our guests, and of course our animals. And our animals are our first commitment and our biggest priority. They are our mission, they're why we exist. And keeping them and all staff, but especially those that care for the animals, was mission critical. Closure is hard on any business. I realize that, and I am not minimizing anyone's hardships that came from it. It was really hard for us because we're this strange mix of being a nonprofit cultural attraction, but yet also an essential service. So again, not that it's easy in any circumstance, but unlike organizations that could minimize losses by closing their doors, turning off the lights, and laying off staff, it was necessary for us to continue to operate to care for more than 750 animals that live here. So we were closed, but still caring, which became a bit of a tagline for us. Even though many of us had to remain working, most of us had to remain working, like many other businesses. We laid off all of our front-facing staff. We drastically cut salaries of staff who remained, and we sent anyone that could work remotely home to do so. And we still have many staff that are working home remotely that are in high-risk categories. In all, our payroll reductions during that closure was greater than 20%. So it was really imperative for us to slow down the hemorrhaging of cash because, you know, we were closed. And I really should go back one if I can. I think I skipped a page there. I mentioned our first commitment was to our animals, but we did all of that and we still were hemorrhaging cash. So while we were closed to the public, we used many of the resources that Bradley discussed and that he will discuss, but we took some unusual measures in our essential operations so that we could be safe and to mitigate the risk of the coronavirus essentially taking out our staff. This is a brief video clip I'll show from our Director of Animal Care and Conservation, and he talks a little bit about while we were closed. We'd sent home everybody else that we could, and then what we did to ensure that our staff were safe.
So, we have just over 700 animals here at Zoo Knoxville, and during this pandemic, we've got to prioritize their care as well as our staff care. Because the animals are still here, they still need to be fed, they still need to be enriched, they still need to be cleaned, and so we have staff in place with various levels of protection, depending on the species that we're dealing with. Protection mostly for the animals as much as anything. Care is the priority here. Again, care of our animals and care of our staff. We've changed things up a little bit by rearranging keeper schedules, so we have, as best as we can, 2 teams taking care of each of the departments, whereas they were one cohesive team before all this happened. We're doing this for obvious reasons. I mean, if someone were to get sick and the other person was exposed on that team, then the whole team may go down. So we're trying to avoid that by altering days off that were a little different than they were before, and making sure that these teams overlap as little as possible in case, worst case scenario, somebody gets sick and we have to have the second team come in. Training is.
So while we were closed and visitors couldn't come to us, this is a great example just in this case to tell you of how we tried to mitigate risk and keep our staff safe, is divided in what we called these A and B teams. But we also began to use this as a way to stay top of mind for our guests. So we could not have the guests come to the zoo, but we knew that we sure as heck needed them when the doors opened up. And so we, all we could do during that time was stay top of mind. So we started this series called Bringing the Zoo to You. And we ran that sometimes daily, and it was just really eaten up by our community, people watching it that were home, schools were out, people were quarantined. So it got a huge amount of viewership and allowed us to continue to essentially fulfill our mission through conservation education and provide some source of outlet while people were at home. Just like I bet most everybody on the call, we knew we were in the biggest struggle of our history. It's now the end of October, and doesn't it seem like, looking back at early March, that this was just years ago? But so we were closed. As I mentioned, it was our most vulnerable cash position time. We'd cut all the expenses we could. We were operating in an essential way to keep our staff safe. And now we had to turn our attention to what are we going to do about cash? We had very little cash reserves. We're burning through cash really quickly, and we couldn't do it without financial assistance. So we considered whether going public and being transparent with our financial problems was the right thing to do when we knew that so many people were laid off and also were hurting. Commonly, most people don't realize that we are a 501c3. We are not owned by the city. Our property is owned by the city, but we are a self-sufficient standalone organization. And we generate 86% of our operating revenues from paying guests and members. And every day that the zoo was closed, we were losing an average of about $22,500 a day. And that's revenues that weren't coming in, yet we still had the greatest majority of our staff still there working. So there was such interest in quarantine. We were getting a lot of questions when everyone was locked down about how the animals were doing. And so in the end, we felt that we had a responsibility to let the community know that we were in trouble and to ask for their help. And in the end, I feel like, or not in the end, but as we've gone through it, our vulnerability and transparency in our message, I think, inspired their trust and their generosity. So 1,800 donors, lemonade stands, one small $50 gift at a time. We raised over $2,500, $250,000 through community support. And so that was really humbling and so touching that so many people cared so much to give that. But we couldn't have done it with just the community alone. So, you know, we are a community organization. We were in trouble, and so we also received help from the city and the county. We applied early and received funding through the Small Business Administration and received a paycheck protection program. And that was critical because it allowed us to restore salaries we cut and start to bring back key staff that would be able to help us turn the curve and open quickly when we were able to. We also applied for and received funding from the CARES Act administered through the state of Tennessee. So all of these efforts allowed us to continue to operate, albeit leanly, while we were closed, and be poised to recover. So no sooner had we secured funding, and that was a really critical time. I used to wonder all these people who were learning how to knit and catching up on all of their episodes of This Is Us. We weren't eating or sleeping. It was 24/7, as I'm sure it was for many of you. We had to get open as quickly as possible. And so literally within a couple of days, we moved from this funding crisis to pivoting on how we were going to reopen. And that happened because we found out that we would be able to open more quickly than we ever expected. In fact, it took us longer to get reopened after the city and the state said go than we legally would have been authorized to do so, because we were scared from a legal standpoint. We didn't know how safe we needed to be and what exactly that we needed to do. We had to ramp back up and rehire staff. So ramping back up was a calculated effort, just as closing down was. I don't think I mentioned, but when we were planning closure, we had the benefit, if you want to call it that, of our colleagues on the West Coast who had closed down a few weeks ahead of us, and they were at ground zero. So we are not a proprietary profession. So we were sharing information, and we were able to start to prepare for closure a week or so before it happened. It was the flip on reopening. We were one of the first institutions, zoo or aquarium in the country, to reopen. And so then we were sharing that information. So we were really using that Tennessee pledge as our guidebook in especially how to reopen. When we reopened, we have the benefit of being outside. So we were able to open early as a passive use only facility, much like a park or a greenway. And as such, our buildings and indoor dining areas remain closed. The city and the county were very fortunate that they allowed us to open in phase one. Our counterparts in our profession across Tennessee were not as fortunate, and some of them opening up as much as a month later. So we knew we had a responsibility to make our parks a safe place that visitors could trust. We followed weekly trend and survey data of cultural attractions, and we did our own perception studies. If you're interested, I would recommend that you follow a lady. Her name's Colleen Dillenschneider with Impact Associates, and her blog's Know Your Own Bone. And Impact studies guest behaviors and attitudes for cultural attractions, but in some ways, in many ways, their research is good consumer behavior studies for any business. So we were watching her. She was putting data out weekly. We found that what was being reported nationally with intent to visit and public perception almost paralleled locally what she was seeing nationally. And we knew that we were constantly monitoring what guests felt was most important to feeling safe and coming back. And then we used that through all of our communications platforms. And knowing what your customers want and need to feel safe, even today, is a point I can't press upon enough, because that changes sometimes on a weekly basis. So what are they feeling? What do they need to feel comfortable? And then how can you provide it? So early on, our data indicated that visitors wanted to see others using the zoo and to exactly know how to navigate their visit. So more than any time before, they needed to plan. And this video, I won't play it all, but it was very explicit to let people know exactly.
Targeting a date.
We took all of their questions and then used it to put this out.
Target date because we have lots of things we are doing to get ready to welcome you back. One of the biggest ways that
So I won't make you watch all of that. Not very exciting, but the point was we were just hammering over people's heads all the questions and all of the research that we saw that they needed in order to come back and to feel safely. So we wanted them to know what to expect. And we wanted them to know that they were our partners in helping us stay open. And we told them that again and again. Thank you for helping us stay open, and do it by helping us by practice these 5 core actions. We had online tickets and timed entry, and we were continually juggling how much is too much to make them feel safe, how much is overkill. Any of you that are running your businesses and your budgets know that being safe is expensive. And we were on a very lean budget. So, you know, we had legal and liability concerns. We, again, looked to Tennessee Pledge and our local task force. We wanted guests to continue to trust us and keep our promise. So we were being sure that we looked at tight touch points. We had one-way traffic only. We took play spaces away because play spaces were closed here in the city. And so anything that children like to play on, if we took it away if we could, because a child might not understand why they couldn't play on some structure they always play on when they come to the zoo. And we wanted people's experience to be good. So we took it away where we could, and we wrapped it when we didn't. And then we communicated again with everything out in social. Our media partners were really great to help us. And then this, an audio recording at the zoo. And then this video was on our website as they bought tickets.
As safe and enjoyable as possible. Thank you for watching this video. Here at Zoo Knoxville, we're going to have timed entry for our zoo. And what that means, there's going to be a limited number of opportunities for people to come in each day at each hour, so we can keep everyone safe. So whether you're purchasing a ticket or a member, please go to zooknoxville.org and reserve your spot before you come to the zoo. We've set up directional signs throughout the zoo to help your visit go smoothly and to control the flow through the zoo in a one-way manner. For your safety, we've placed over 30 more hand sanitizer stations throughout the zoo. Indoor space, play areas, and attractions will be closed during this phase.
So you all know the drill of the pandemic by now. You know, these are no unique tips. This is what we do in every supermarket and everywhere we go. So, but for us to be sure that we knew from the trend data that the first thing people wanted was to know what to expect and to see other people doing it. And so that was our way until people got into the zoo of showing them how to see and experience the zoo. And that's a continual something that's going on a ever changing basis. We based our reopening campaign on managing expectations and on shared responsibility. And we were relying on our customers to endorse us as a safe place and wanted to be able to thank them for helping us rebound. So we were continually monitoring both compliments, but also complaints to see how we could be better and making changes really quickly based on that. We saw pretty early on that one-way traffic at the zoo actually created congestion versus just letting our guests diffuse themselves. So that was a change that we made really quickly. We were seeing it ourselves, but guests were responding, and we were trying to be sure that we were very responsive to what they were feeling. So moving forward, obviously, just like all of you, it's still ongoing. Our data shows that feeling that the zoo's a safe place is still top of mind for our guests. And we continue to navigate the pandemic and to operate our business. We continue to develop protocols and tweak and reevaluate them based on the crowd and the season. Our leadership team is meeting, in the beginning, we were meeting daily, sometimes twice a day, now weekly, and we continually adjust and monitor what we need to do so that we can be nimble. We've since opened our indoor buildings, our restaurants, following the restaurant guidelines and play spaces. So there's a lot of different guidelines that are out there based on the type of business, and all of them are sort of reflected here at the zoo. And so we are continually monitoring that. We are a nonprofit, and so several of our fundraisers have had to be canceled or modified. This is our Zoofari Gala. Many of our festivals, Feast with the Beast, Wild Vine Brew, all of those had to be canceled. But Zoofari was a hybrid virtual affair. So that top left corner picture you see was in the studio where our auction and camp videos and cameos were live and videoed, but then we hosted small house parties all over Knoxville where people could party in their bubble with their people they were comfortable with. And that resulted in one of the most successful galas that we've ever had in terms of revenue. And we will continue, in fact, to make that be a model going forward. We reduced hours at the zoo because it just wasn't profitable to be open on Monday, Tuesday, and Wednesday past 2 o'clock. We then extended our hours, and so in the evenings, and we paired it with craft beers and food trucks, and that was really successful. And these are changes that maybe we would have been scared to make if the pandemic hadn't have forced us to be really, really creative. And this is another example of one where we will continue to probably operate in that same model next year. We just finished Boo at the Zoo, and Boo is one of our biggest fundraisers. We had to operate Boo, but we changed that from the touchy-lovey, hug the character event that it has been for the past 33 years. This year, it was more of a sensory experience. We added lots of dramatic lighting. We spread our trick-or-treat trail through the entire footprint of the zoo to help with social distancing. Our volunteers were pre-screened and masked and gloved, and we pulled that off. It was crowded. We had to limit crowd sizes, but we pulled it off fairly well, I think. And to Bradley's point, I saw an email last week of a lady who said, my son-in-law was there and now he has COVID. So you need to tell everybody that he has COVID, and he came and they could get it too. Well, how do you address that, you know? And what's your legal responsibility? So Boo's just finished. Our next big event is coming Black Friday, and it'll run through the end of December, and that's Zoo Lights. It's another passive experience, this beautiful, larger than life, exotic animal, silk lighted display. So we're hopeful that that revenue opportunity will help us recover what we lost. And then in closing, I know I'm going just a little over, being closed in the most beautiful springtime I can remember was just surreal, and it was really painful, as I'm sure it was for many of you. And when people started returning, not only did my team and I feel emotional to see the zoo being used for what it was intended for again, but we heard from our guests that they were overcome with emotion. And while we were closed, we asked them, share your memories of the zoo with us. And they sent us all this user-generated imagery that was so overwhelming. We used it as part of our ad campaign. So it's a really quick commercial. I thought it would be a fitting way to end. And so let me play that for you. So that still almost gets me today. I know I'm a little more sentimental than the rest, but you know, being a place that can instill even a vague the smallest sense of normalcy, and being a refuge in that way has really been something that has buoyed us. And it was, but again, listening to Bradley, which I think we'll pitch it back to now, all of those questions he said that businesses were exploring were definitely ones that we were struggling with and continue to struggle with today. Guess it's you, Bradley.
Right. Thank you. Thank you, Lisa. That was great and very, very helpful. We're going to transition now, and I'm going to talk a little bit about resources and then really turn it over to Nicole, who is really the expert and helped us tremendously in drafting the legislation that you all will get to see and look at here to help you all. But as we start to think about resources, we were asked from a number of businesses and nonprofits, what do you recommend we do to protect ourselves or to make sure that we can defend our business if there is any sort of allegation that comes forward. So one of the major things that we do, you see the Tennessee Chamber certified site, is we developed a Tennessee infectious disease certification for businesses, and it can be used for nonprofits, and we also have that for employees. We felt it was important anytime there is going to be an allegation, and if in OSHA we'll get called, and OSHA will come and make an inspection. Although OSHA really does not oversee infectious diseases, they still can look at your operations to see if you were kind of outright negligent or if you just didn't try to avoid anything. This designation, if you're certified, and I think it's a 3-hour course that you take, and you can have a sticker that you can show your customers and employees, and it really helps to build their confidence. We partnered with a group, saying Peak Performance. They're here in Tennessee. They developed the class, the criteria for it, following Tennessee Pledge, CDC, WHO guidelines. So if you do get a complaint, one of the first things they're going to ask is, do you have an infectious disease kind of program, or how do you handle to make sure your facility and your site is safe? And this course really walks you through things that you can do. You have to submit a plan, a certified infectious disease plan, and then you can use that. We've got a lot of very positive feedback from employers that have utilized that. Also on our website, you'll see there is a number of information that we have. Largely that comes from a U.S. Chamber or resources that we have from the state of Tennessee. Their Tennessee Pledge was recently revised to become a much shorter document, which we think is extremely helpful for you all to utilize, and that can help you to develop an infectious disease plan. So with that said, the Tennessee Chamber, our relationship with Waller is, as we've talked about, we engage with the Tennessee General Assembly, and we can't do it alone with the staff that we have over here. So we hire contractors, and Waller is a great partner with the Tennessee Chamber. Any type of business-related question that we have come up, Nicole and her team, look into it and provide us tremendous assistance. So that can be from tax policy to most recently this legislation that we work to draft here. So they're a great partner with us. Going back and setting the stage for Nicole, the legislature abruptly adjourned around April the 18th and said, we need to mitigate. We're going to follow everybody else. The governor's issued really stay-at-home orders, so we're going to hurry up and adjourn to avoid any sort of spread of the virus. And then we will we'll come back in on June the 1st. We'll see how things are going. So a number of legislators asked us, what can we do to help Tennessee's business community and our nonprofit community, those that are really out on the front lines of this? And the first thing that came to our mind is really liability protections. That's the number one concern we hear. The federal government recently did, with the CARES Act stimulus, and Tennessee got about $5.3 billion of that. And Tennessee's not in a position, really no state is, to issue that kind of stimulus support. So on the stimulus side, things had kind of been taken care of. So the state could, though, enact liability protections for us. Unfortunately, the first round of that legislation, it failed. at 2:00 in the morning on June the 18th, 18 days after the legislature went into session, which was extremely disappointing to the business community and the 33 other partners that we had that was working toward this legislation. And those were business trade associations, all the way from, accountants to healthcare facilities to construction entities. Everybody came on board and supported this. It just shows how difficult it made our life. We engage with people and talk to them about proposed legislation, but when we weren't allowed in the General Assembly, it made things very difficult. So the first round of the legislation failed, and it was very, very disappointing. Typically in Tennessee, we always are able to get a really good shot at either passing legislation or propose or stopping it that harms Tennessee's business climate. So luckily for us, the number of state leaders and individuals, I know nonprofits and companies, talked to legislative leaders and said, we really have to come back in and fix this because it's a major problem out there. It's a major problem to Tennessee's economic recovery because you all know that whenever the shutdown happened, it really devastated, especially a number of small businesses in the hospitality sector. And also it had the capacity to really harm Tennessee's nonprofit communities as well. So the legislature, Governor Bill Lee, after talking with Lieutenant Governor Randy McNally and House Speaker Cameron Sexton, agreed to call a special legislative session on August the 1st. They quickly passed the legislation that was proposed by Governor Bill Lee on August the 3rd. So they came in, got to work and passed it, and we were very, very thankful for that. So with that said, I'm going to turn over to Nicole to really walk us through and provide some perspective about the legislation and how it helps you all.
Thank you, Bradley, and thank you all for having me. As noted, I work with the Tennessee Chamber. I'm an attorney at Waller Law Firm, but in my role as Government Affairs Counsel to the Chamber, it was part of my responsibility to be a part of the drafting committee that wrote the COVID-19 Recovery Act from April until August, until it was enacted into law. So it took months and months and months to get to this bill. And we feel that it's a great, substantial bill and one of the best that's been passed across the country so far. So I'm going to dive into actually what the COVID-19 Recovery Act does. So the Tennessee COVID-19 Recovery Act implements comprehensive liability protection against unsupported legal claims stemming from loss, damage, injury, or death arising from COVID-19. The Act specifically states that an individual or legal entity, and it's named a person in the bill, will not be liable for loss, damage, injury, or death that arises from COVID-19 unless the claimant proves by clear and convincing evidence that the person proximately caused the injury by an act or omission constituting gross negligence or willful misconduct. So that's a ton of legalese. So let's break that down. What it means is that if you are an entity that's open, let's say the zoo or any other nonprofit entity, you just cannot be constituting gross negligence or willful misconduct in your acts to be guilty of spreading COVID-19. That's a pretty high standard of care. I mean, the normal standard of care in these cases are simple negligence. So we feel that that goes above and beyond to really protect our business community and nonprofits and other entities all across the state. The Act is applicable to any action or healthcare liability noticed or filed after August 3rd. And as you remember, that's the date that Bradley said the legislator passed the bill. We went in from August 1st to August 3rd in the special session, and it was passed on August 3rd. So that's when it became applicable. And the governor then signed into law the bill on August 17th. Now, we have mentioned in the past that you all have been following certain guidelines, the Tennessee Pledge, the Knox County Health Department guidelines, the OSHA guidelines, the CDC guidelines, and all of those are great and still applicable. And everyone on this call should be following those to the extent necessary to wherever you are across the state and whatever applies to you locally. None of those guidelines are mentioned in this bill specifically because we thought that when it got to a litigation point, that those guidelines would pigeonhole you to certain guidances that you would have to be following. And if they're not mentioned, that makes the litigation process easier. And you can just say that you have been following one of these and that you weren't grossly negligent or willful or showing willful misconduct in following these. You can go to the next slide, Ellie. So who's covered under the Act? It's listed out specifically in the bill, and I'm sorry we don't have a copy of the bill for you, but I can link it in the chat when this is over because I want everyone here to have a copy of the enacted law if you don't already. Individuals are covered, healthcare providers, sole proprietors, corporations, limited liability companies, partnerships, trust, religious organizations, associations, nonprofits, and any other legal entity, whether formed as a not-for-profit or profit. So as you can see, it covers the entire gamut of people across the state, any entity basically doing business essential or not at this point. Again, in the bill, it is defined as a person. So a person is defined to compromise a wide array of any of these covered entities that we just listed. So when you get the bill, you'll see how it's drafted and specifically how it's listed out. So you can go to the next slide. So now let's get into the legal specifics. What does this mean? And what are the burdens of proof and pleading standards that an entity has to prove in order to be covered and not liable for COVID-19 cases? So under burden of proof, a claimant or a plaintiff that would bring a case against an entity, such as anyone on this call, must prove again by clear and convincing evidence that the loss, damage, injury, or death arising from COVID-19 was proximately caused by an act or omission of the defendant, you, the entity, that constituted gross negligence or willful misconduct. And I'm sorry that I keep repeating this, but we have to instill the gross negligence and willful misconduct standard because that's such a high bar and such an important thing for you all to remember when you're conducting business across the state. The pleading standard, which means the legislation creates a hiding pleading standard, which requires a claimant in any action arising, alleging injury arising from COVID-19. So you have somebody that comes to your facility and they say, I got COVID at this event. Well, then they have to prove some things. They can't just say that and sue you or take you to court. They have to file a verified complaint with pleading specific facts with particularity from which a finder of fact could reasonably conclude that the injury was caused by the defendant's gross negligence or willful misconduct, your gross negligence or willful misconduct. And they also, they also have to file a certificate of good faith stating that the claimant or the claimant's counsel has obtained a signed written consent statement from the physician clarifying that the alleged loss, damage, injury, or death arising out of COVID was caused by you, the defendant. These are really, really high standards. And the key here is they get one chance at this. So if they take you to court and with these pleading standards and they filed a verified complaint and a certificate of good faith, and the judge says this is not enough and throws out the case, they cannot try it again. So that was also a part of the bill that we were very happy to get in. A claimant's failure to comply with these pleading standards will, upon motion, make the claim subject to dismissal with prejudice, which is what I just explained, that they get one bite at this apple. The heightened standard applies to any action alleging injury arising from COVID-19, including healthcare liability actions and actions against the state, businesses, schools, and institutes of higher education as well. So as you know, nonprofits are covered in businesses and healthcare entities, but also schools and county governments are covered as well. So if any of you are entities of a school or a county government, you will fall under GTLA, but also have these protections under the bill as well. The proof of applicability. So what this means is the act applies to all prospective claims arising from COVID-19 filed again after that August 3rd date when the legislature passed it. In response to concerns raised about pending COVID-19 lawsuits, the act includes a grandfather clause. So there's another element. Yes, everything going forward from August 19th is covered under the standards the pleading standards and the burden of proof I just explained to you. But if you do have an incident that was filed against you before the August 3rd date, then that clause must include a complaint or civil warrant was filed, a notice of claim was filed with the Tennessee Claims Commission, or notice was satisfied under state law pertaining to healthcare liability claims. Honestly, most of anything that's going to be filed before the August 3rd date would probably be healthcare related more so. I don't know if there's any healthcare entities or nonprofits on the call, but those are going to be geared more toward healthcare entities just because they were the ones that were essential workers and still having to be open and active during the pandemic, because a lot of you were just slowly reintegrating to reentry and reopening at that time. Previously filed complaints related to COVID will be subject to a simple negligence before the August 3rd date if you can't be filed under the grandfather clause. So if you do have a claim before August 3rd that doesn't fall within the grandfathering clause standards, then they'll just have to prove that you were simply negligent. The act does have a sunset date. And for those of you who may not know what that means, or in our political world, I forget sometimes that y'all don't know a lot of our lingo, the act remains into effect until July 1st, 2022. So it's been enacted and will last until 2022. And the reason that the legislator did that is so that we can revisit at that time and see if there are any changes that need to be made, where we are in the status of the pandemic and emergency orders, and if things need to be strengthened or actually removed from the legislation. You can go to the next slide. So what does this mean for covered entities? So any file claimed against a covered entity alleging injury from COVID-19 will now be subject to these heightened pleading standards, which requires the claimant to prove gross negligence or willful misconduct on behalf of the defendant by clear and convincing evidence. Repeat, repeat, repeat. The act's dismissal penalty for failure to file a verified complaint and certificate of good faith with the complaint is meant to weed out any frivolous claims against covered entities in the beginning stages of litigation. So we were very happy with being able to get so many high standards of pleadings and burden of proof and these verified complaints and a statement from a doctor in our bill, which some states don't have, because we really feel like this is going to weed out litigation from the beginning and save you all money from going to court from the very beginning. The legislation preserves the legal remedy for claims against grossly negligent entities. So we were getting a lot of pushback at one point that, oh, y'all are going to protect bad actors. No, the bill does exact opposite of that. A bad actor, if they were grossly negligent or willful misconduct, then they're still going to be responsible. And that's what we need. It's to stop the spread of the pandemic as well. In addition, the act allows businesses to safely reopen with the assurance of protection and helps to keep the economy running and growing, which was the whole purpose of the bill. And as Bradley stated earlier, through his survey with chamber members, all they wanted was to be able to safely reopen. And I'd like to give Lisa kudos, because I feel like that they're the poster child for how they did it correctly, and they're reopen and thriving and helping the economy, not only in the Knoxville area, but they're in their own business and helping people to get out of their house in a safe way. So if anybody has any questions or specifics, I'm sorry about the legalese of the bill, but I wanted you to really, really hone in on the gross negligence and willful misconduct standards and the pleadings, filings that are necessary, because I want you to feel that you're protected under this legislation, because we worked really, really hard to get something to protect you so that the Tennessee economy could reopen and that you would be safe as well. Again, I will get you a copy of the enacted law, and I can link it or send it to Ellie, and she can send it out however you want to handle that, Ellie, and we're happy to answer any questions. Thank you.
Okay, forgive me for that little delay there. I was typing an answer in the chat. So thank you so much to our three speakers, and anyone who wants to turn on your video. We would love to be able to see your faces and have kind of, a good small group discussion here. We have a couple questions that have come up in the chat, and so I will read through those and then let our speakers address those as makes the most sense. Okay, so we had a first question from Pat Hardy. Pat, feel free to jump in and clarify if maybe you want to rephrase any part of your question after listening to the presentation as a whole. But Pat had a question early on, and I think this is probably for Lisa. Lisa, can you talk us through who helped make the key decisions about the zoo and your actions? He's asking, was it you or you along with key staff, line employees, your board? If you could kind of talk through that decision-making process and who was involved, that'd be great.
Yes, sure. I'm happy to do that. I think I mentioned that in our profession, we had closures happening in advance of us out on the West Coast. And so they were putting together a lot of information and sharing that out for us to model after. So it started first with the staff and the leadership team. We then were just grabbing everything that we could grab from the CDC, from Tennessee Pledge. Here in Knoxville, we had the COVID task force. And so we ran reopening plans by that task force. We even ran it up to our state legislators, Senator Massey and Briggs. We let see that to give input because we just wanted everyone up and down the chain, so to speak, to know. And you ask about the board. The board was involved when we closed. Our chair of our board immediately established 4 ad hoc committees that guided a lot of what we did. But the one that pertained to reopening was our guest revenue committee. And so we ran the plans by them. They came out and walked this committee, walked the zoo with us, saw what we did. And so we tested and ran the opening plan by many before we did it. And then actually all those committees have now dissolved. They were ad hoc committees with the exception of the guest revenue committee, and they have been so instrumental in helping us. And we look at our per caps weekly, we look at any safety and guest experience guidelines, and we can continue to meet with that committee on a weekly basis. So it was very much a team effort and just gathering all the resources of others as we navigated through it.
Great, thank you. Let's see, we had another question from Debbie about, Debbie, I see you're still with us. If you want to jump in, feel free. We would love to know what organization you're with. Debbie's question is to you, Lisa. Have you and do you continue to conduct temperature checks upon entrance?
You know, we thought about that. We do not do temperature checks of our guests. We do self-reported temperature checks of our employees, and we have a temp gun station. Logistically, it was just really too hard for us to figure out how to coordinate all of our employees and get them to work and working safely with temp checks, and also to keep traffic flowing in the zoo. So at our entry, at our queue point, we were worried about creating more problems with temp checks through people bunching up at the line and causing social distancing issues than we were getting them through and allowing them to go ahead and space themselves out. So we didn't do it for guests. We do it for anyone coming on the grounds that is a third-party vendor. We did it, for instance, for our volunteers for Boo at the Zoo. We did temp checks and daily screenings with them, and we do that with our staff, but it is a self-reported. I know the Tennessee Pledge says it's best if you could do them as employees come to work, but logistically, we could not figure out how to do that and operate, so we opted for the self-reporting, and then if there's a question or you forgot to do it that day, we have temp gun stations for them to check in with.
And Debbie, I don't know where you're located, sorry, but I think that's an individual business decision, but make sure that you follow your local guidelines too. I mean, most of the local guidelines in Knox County, Hamilton County, Davidson are just the mask mandates in the big counties, but I mean, just make sure that there's no temp thing there. I do think it helps from a perspective of liability, because some people don't know if they're running a temperature, but it's not legally required.
And that actually was a recommendation from our legal, one of the legal counsels on our board, when she reviewed our opening plan for not our guests, but for our staff. She's like, you're doing daily health screenings, but you're not doing temp checks. And I was like, well, you know, and so she's like, yeah, from a liability standpoint, you need to at least have them self-report. So we added that, and it's not been a big deal.
Great. So just to go in order, and then we've got kind of one nice forward-looking question, I think. But we had a couple people ask if they could see the slide deck. So I always take that as a compliment when someone wants to look through it again. We didn't plan to post the slide decks, but we are recording, as we said on the front end. And as soon as we get that recording trimmed and transcribed, we will be posting it on our website, which is webinars.tennessee.edu. You all as attendees also will receive a follow-up email that gives you the link to that recording once it's posted. You can probably expect that, I'd say, by Monday. We'll also be asking for some feedback from you about the session and if it met your learning objectives. But as I noted in the chat, if somebody really needs, a slide or two out of the deck, I put my email address in there, and you are welcome to email me directly, and I'll get that information for you, because we want the session to be as helpful to you as possible.
And once I get you a copy of the bill, my slides might become irrelevant. Everything in there will be what you need anyway, but you're welcome to have mine.
Great. Does anybody have any question you want to jump in with? And then Eric has put one more question in that we can take next. Okay. Eric has a question. It's probably more for me, but I actually think maybe those on our speakers might want to speak to it a little bit. He's asked if there will be a session that explains how to respond to and minimize the effect of an outbreak among employees, which obviously I know, Lisa, that's something that you all have probably built into your plans, how you respond if something like that happens. So I thought maybe you would want to touch on that to Eric a little bit.
Yeah, sure. I think I mentioned we showed in that video that we, with our essential care team, so it wasn't necessarily our guest facing staff, with our animal teams, we divided up into what we called A and B teams, essentially two group of staff within the overall team that were quarantined from each other, so that if it got into one group of people and they quarantined, then the other group of people could continue working. And that was okay, but it really challenged us from an overtime perspective, caused a lot of, and continues to cause struggles with staffing and communications. You ask if we had plans for it. We're actually experiencing it to a small degree right now. We do have some staff. I have 2 staff members who've tested positive in different areas of the zoo. And so our daily screenings and their self-reporting were 2 ways that we caught it. So they self-reported on the daily screen that they had been in contact with someone with COVID, and that immediately calls for them to not report to work and to call HR. And then HR begins a contact tracing sort of internally among ourselves, asking questions of, have you been in contact with, who have you been in contact with here at the zoo for greater than 15 minutes and less than 6 feet? And we start to isolate people that are secondary exposures or primary. And I know that's the health department's job, but for our job, and the health department does it too, but for us, it was about being as safe as we could. So at any one time, we have had a few people be quarantined that were negative because of their exposures. And so we have just taken a better safe than sorry attitude to it, because it's so desperate to us to keep it out of the animal care staff where we could actually run into a crisis with care. I will say that in one case, though, it was we've not had it in any of our guest facing positions, but in one situation that's since passed, the person tested positive who had been out on a boat over the weekend with a friend, and she self-reported. She was asymptomatic but positive. And then she had contact with her whole team of 4. So we had to quarantine all of them, and we had nobody to take care of this group of animals. And because one of them ended up positive and sick, The others were negative, but still quarantined, and they went and had tests. So we had to set up for them to come in and work essentially in isolation. So they came to the zoo, they took care of their work unit, came in contact with nobody, and even came in and out of a separate gate. So desperate times call for desperate measures. So I don't know if that really answers the question, and I can happy to get more in detail about our protocols for that offline.
Well, that definitely interested in your protocols are probably more extensive than a lot of businesses have in place, and they could learn a lot from what you just explained that you had to go through for an exposure with most of your employees are, like you said, are very intently trying to stay within to minimize contracting the virus, and yet it still finds its way in. And it's how you react and the plans you have in place to quickly quarantine people and test them, and that really saves your ability to stay in business, which is great. So I want to applaud you for that, Lisa.
Oh, thank you. One thing as you were talking, I was thinking of, not to get too in the weeds, but we have, disinfecting guest areas is so important, and they were really expensive when we first reopened, but and I don't want to plug or endorse a brand, but we had this thing called a Clorox 360. It's electrostatic cleaner that it's more than just hosing and disinfecting, with a wet or a spray. It clings to walls and surfaces, and then has a residual contact for cleaning as well. And so anytime, which fortunately has only been a couple of times now, but we've had a positive case, we've also gone back in with that machine. We use it to clean all of our restrooms and high traffic points, just as, and I don't know if it's overkill or not, but it makes us feel better. And the price on those have gone drastically down from March till now, because we just bought a second one.
Oh, Kelvin is typing in the chat saying, please support your local zoo. I know Lisa would applaud that, as we all would here on the call. He was formerly a board member of the Nashville Zoo and served as treasurer for several years. And he acknowledged that this is a challenging time for zoos, to say the least.
And Rick is a good personal friend. And, the Nashville Zoo was forced to not open until either, I think, phase 3 or phase 4. And it's just a difference in local ordinances, because here, our city and county said we could open as passive use only. And then we've gradually expanded that as the city's expanded. But Nashville chose a different approach, and their mayor said, you know what, you can't, he considered the zoo a large gathering site. And so he was looking at those gathering restrictions and how they were allowed to not open, whereas our mayors were saying, if we use you like a park or a greenway outside, we're encouraging people to go to walks, we're encouraging people to get outside, then we can do that with the zoo. But that wasn't the case at Nashville. But one thing we did have to do, and we have still done today, is we stopped anything that would that we would encourage gathering. So I can't help it if the chimpanzees are doing something delightful and brilliant. That's naturally going to attract a crowd. And we expect our guests to have room to socially distance each other. But we did stop our shows, our keeper chats, our demonstrations, all of those really high touch, interactive things that make us so special, and that we were really going to push out hard this year. We stopped that because we didn't want to be to promote gathering. And we also didn't want people rushing in on our staff and making our staff feel crowded, because we still had to protect them too.
Thank you. Eric, I think your question was, are we going to be offering a session dedicated to that? That's not in the plan at the moment, but I will make note of that, that's something you'd be interested in. And I just, excuse me.
Yeah. Yeah,
Eric.
I would say just check with see if there's interest in it. If there is, I'd put my name down for one of the folks that would love to see it.
Eric, which organization are you coming to us from?
Well, I'm coming from EDP Biotech, which does rapid response testing for businesses if they have an outbreak.
Got it.
So I'm a little biased, but I've
Right.
also had COVID and I have antibodies. So I'm coming from both sides of this story, frankly.
Got it. Well, that is it for our questions, unless somebody wants to jump in with others, and we're right on time. So I will just say a final thank you to Nicole, Bradley, and Lisa, and to all of you for joining, and to anybody who watches the recording in the future. We hope you find it helpful and that it provides the guidance that you need to navigate the pandemic. I will plug our future sessions. This is one in a series of 11. This is the 4th this week, and all of those recordings will be added to the website soon. And we take next week off. We figured that, there was that thing happening next week that might have people's attention. And so we will ramp back up again the following week. Is that the week of November 10th, 11th, something like that. And then we will commence end this series November 19th. So we hope you'll check out the rest of the sessions. It's webinars.tennessee.edu. And with that, I'll wave goodbye.
Thank
Thank you all. Great session.
you.
Great.
Thank you.
Thank you, Kelvin.